Hello everyone, welcome to Vajiram and Ravi's Data Stories, your one-stop solution for value addition. In today's session, we will be continuing with the data of National Family Health Survey 6, which is going to be a very important value addition for your upcoming mains examination. So let us start with the fundamental numbers, starting with institutional delivery. So there we have seen a remarkable increase from 88.6% in the last National Family Health Survey. Now we have reached to 90.6. Now this is where we have to understand where we can use this number as an example. Janani Suraksha Yojana and also Janani Shishu Suraksha Karyakram. This is where take up this number with, because these are the flagship healthcare programs for mother and infants which have driven this number. As of now, the skilled attendance in the number stands around 91.8. Then moving on to the next parameter that we are going to talk about is the C-section rate at the national level. That has also unfortunately increased from 21.5% to 27.2%. Higher incidence in urban areas with 40.5% and further higher in private hospitals. The concentration happens to be 54.1%. Why we are saying that this number is not so fortunate is because the WHO established optimal percent is 10 to 15%. So this is where we need to point about the lacunae existing in the healthcare system, especially when we are talking about the C-section. Apart from that, another big parameter, total fertility rate, which has come to be stable, that is 2.0. It has dialed down from 2.1. Urban total fertility rate 1.6%, rural 2.1%. However, based on SRS of 2024, national total fertility rate was taken up as 1.9. But NFHS-6 has come out now, so we can take up this very number. Now, the next parameter that has been highlighted is about the obesity. We are seeing high women obesity where it has gone to touch 30.7% from 24%, more concentration in urban women 42.8%, rural women 25.5%, which is also pointing us towards that how an epidemic of non-communicable disease, obesity and diabetes is driving this up. So we will be looking into detailed numbers as well related to overall obesity and diabetes in upcoming section. Now let us move to a detailed understanding on TFR. Total fertility rate, we can clearly see that India has come down to 2.0 from 2.1. The replacement rate was 2.1. Now in this context, certain states are below replacement rates, where it includes 25 states and union territories. A high pointer here, whenever we are talking about southern states and comparison with northern states, all southern states have below replacement. TFR is less than 2.1%. But certain states, also known as EAG states, that is Empowered Action Group states, which are socially, economically, comparatively backward. So in this list, we have MP, UP, Bihar, Rajasthan, Jharkhand, Odisha, Chhattisgarh and Uttarakhand. So above replacement, we see 5 states only, and in this concentration is of 5 of them belonging to EAG states, which includes UP, Bihar, Madhya Pradesh, Jharkhand and Chhattisgarh are falling in this list. For global context, the world total fertility rate falls at 2.3, and if we are comparing it with China, 1.1. Urban total fertility rate 1.6, which is well below replacement, and rural total fertility rate 2.1, which is exactly the replacement rate. Now very quickly, replacement rate is the rate that the number of children a woman needs to have to replace her partner and herself in the given population. So in this context, we have covered total fertility rate across. Now let us move to another parameter in detail so that we understand the C-section crisis, which I initially pointed out. So if we look at the WHO optimal, it is 10 to 15%. India public healthcare institutions 16.9%, but when we are looking at private institutions 54.1%, highest incidence in Telangana with 62.2% is seen. And if you want to see the stark reality here, then the private hospitals Telangana 83.9%. So national number for India, which has increased, stands at 27.2, but this shows that how there is a crisis because there is medicalization of childbirth driven by private incentives. So this number clearly justifies that. Apart from that, India's national average, you can see, is clearly double of the optimal level that has been defined. So this also talks about the private sector incentives driving this medicalization of childbirth as well. Now moving towards the NCD crisis that I was talking about, if you look at first thing that is for obesity, you will see for women it is 30.7%, for men it is 27.3%. But if you see the number for urban, this shows us a urban crisis, 42.8% for women, men 36.3%, diabetes 21.9% in women, 23.9% in men. And if we see the rural areas, they are thankfully comparatively lesser as compared to urban. Overall, still the numbers remain high and they have increased hugely as compared to NFHS-5 for overall 24% to 30.7%, 22.9% to 27.3%. 13.5 to 17.8 and 15.6 to 20.9. Now, if you remember the first part, if you have not seen it, go see the first part of NFHS-6 data story. In that, we talked about how underweight children incidence is increasing 31.8%. Now, club it with obese mothers, the national average 30.7. This creates a double burden on the whole medical infrastructure and it shows India's epidemiological transition where the non-communicable diseases such as obesity and diabetes are increasing and highly concentrated towards urban population. Unfortunately, where healthcare infrastructure is tightened, the numbers look good. In the southern state, this is where we are seeing high obesity rates. Kerala, Andhra Pradesh, Tamil Nadu as well, and also highlighting a huge urban-rural gap as well. Now, this was all for today's session. We will be coming up with another session for NFHS-6. Stay tuned till then. That was all from my side. Thank you so much.